Hello and welcome to Creating Hope in Our Community, our series of podcasts talking about suicide prevention. Today I'm joined in the studio by Catriona McDougall, Project Coordinator from Scottish Recovery Network. How are you doing today, Catriona?
I'm good, thank you. Starting to warm up after being out in the cold.
So it's a bit chilly this morning, so good to be inside. So let's kick things off then. So for people who are listening who are maybe not familiar, can you tell us a wee bit about Scottish Recovery Network?
Yeah, of course. It's always a funny thing because people think we sort of deliver services, but we're very much an organisation that works with services rather than delivering it ourselves. We are working to kind of make Scotland a place where people can expect mental health recovery and are supported at all stages of their recovery, and it's led by them. We tend to bring people, services and organisations from across the sectors, third and public, to kind of work together to create a mental health system that embraces peer support and is powered by lived experience. And we want that lived experience just to be involved in a meaningful way, not that kind of token, like, here's this feedback survey. We want sort of lived experience to be in the decision-making rooms, in the sort of rooms where decisions are made about funding, designing services, delivery of services, because they know what works, they know what's worked for them, they know what hasn't worked, they know what puts up the barriers. So that's where we're trying to make our impact. Scottish Recovery Network is a really small organisation. Mm-hmm. We have very tiny team, mainly made of like projects workers.
Sure.
And we've got so many different projects. There's a project that I get to lead on, Creating Hope with Peer Support, which is about how peer support can play a crucial role within suicide prevention. We have other projects going on where we're supporting small community groups, third sector organisations, to integrate and roll out a peer support service alongside their own existing services, to integrate peer support roles within their teams. We also host online events, webinars, in-person events, trying to share what is happening within peer support around the world. We recently had a brilliant online event with the Resilience Collective in Singapore, and it was so good because it's just sort of like, they're all in Singapore and they're talking about peer support and they're using the exact same language we are, and it's having the impact that we're seeing in Scotland as well. And there's so much we can learn from each other. So we try to, build the evidence and sort of share the knowledge and experience that we're seeing around the world and try to get Scotland to adopt it more. Provide the space and opportunity for people who are delivering peer support or interested in peer support to kind of gain the skills and information. We basically act like a catalyst. We're not saying we're the experts at all, but we are going to the people who are, those people who lived experience, those people who are delivering in their communities, and sharing as much of that knowledge and experience they have to as wide an audience, to try and raise the profile of peer support, but also improve the understanding of it, because I think sometimes there can be a bit of misconceptions around that.
That's quite nice. It sounds like almost like a global peer support in itself by, speaking to teams in Singapore too, that's really interesting. So what about creating hope with peer support then? Can you talk a little bit about that?
Yeah. So Creating Hope with Peer Support project comes directly from the work that Scottish Government are doing with their Creating Hope Together strategy. Has different outcomes, and we're sitting in outcome 3, which is wanting to make sure that any person in Scotland, child, adult, older adult, if they're impacted by suicide in any way, whether personally with their own thoughts or attempts, or if they've been bereaved by suicide, when they reach out for support, it's there, it's accessible, and it's the right quality type of support they need at that time. And Scottish Recovery Network kind of saw the opportunity for peer support to be a part of that support. We've kind of been working with local and national suicide prevention partners to boost community-based peer support across the country, because we want to make sure that people have the support at the earliest opportunity.
Yeah. And what role then does peer support have in suicide prevention?
This is going to be a long answer because I feel like so much. It can sit alongside mainstream services when it's integrated really well. There's obviously peer support in itself is very much about an equal partnership, an equal relationship, and an intentional space to talk about mental health recovery. And there's obviously peer support can happen in many forms. It can be over messaging, online, it can be one-to-one, and it can be in groups. And a huge risk factor around suicide is sort of social isolation. And immediately, peer support provides connection, people listening to your experiences, validating what you're going through, and not immediately jumping into how do we fix this for you. It's much more about the person being supported and offered information, offered, the experiences of others to kind of be like, this has worked for me in the past. I'm not saying it'll work for you, but it might be something you want to explore and try. So the person's always in the driving seat. They're the one that's empowered to kind of make the decisions about what their recovery looks like and feels like. And it's something that can be missing a little bit in other mainstream services where there's an expert, a professional who's telling you this is what you need to do. And, it has its place, definitely. There's times where people really need that guidance and that structure. But for some people, it can be really quite scary at times, having that limited power that they have over life taken away in that space. So peer support is something that can be really powerful for people who are quite maybe not in crisis, sort of people who are maybe struggling with their mental health or having just a difficult time in life with life stresses. Life is very stressful at the moment for a lot of people. So peer support can be really protective in that instance. But also we've seen examples in communities across Scotland where there's peer-led crisis services, like there's Hope Point in Dundee. There's also the Nuke in Perth. And this is there's drop-ins, there's phone lines, and it's people who are right on the edge, really struggling. And the Nuke have a brilliant statistic that they've kind of come out with recently because they've reviewed their service over the year. And they've had over 400 people coming through their door. And I think it's 97% of those people have not needed to go on to clinical intervention. So we know it works. We know it can have a massive impact for people. We know it can support mainstream services and take a bit of the pressure off the NHS. And, it's accessible. People aren't sitting there on a waiting list waiting to be seen. So there's just so much peer support can do. And the message we want to kind of share is that it's not instead of, it's like with everything. Because there's examples with the Hive, Love and Harmony, which is in Fife, an LGBTQ plus community kind of service. They have counsellors and they offer therapy. And one of their therapists was at one of our learning and networking events, and she spoke so powerfully about how she couldn't do the work she does in sort of one-to-one therapy sessions without the surrounding support from peer groups, because a lot of times people just aren't ready to take that step, whereas peer support kind of holds them in a safe space where they can, let everything out, kind of be heard, and kind of reach a level where now they're ready to kind of open themselves and accept the support that's there through therapy. So yeah, I think the role of peer support has so much within suicide prevention, and I could keep going.
I was going to say, I get the sense you could talk about this for hours.
No, I've got so many examples, and I just want to sort of, give the credit to all the community groups that we've worked with so far, because they are doing so much, and I think it can be so undervalued and missed by services and kind of local authorities not recognising that small community peer group. It might appear like it's an arts and crafts group or a new mums group, but it does so much more than kind of what maybe they even recognise themselves. So part of the Creating Hope Peer Support project is also to kind of raise the profile and understanding of what peer support is, not only by local authorities and policymakers and funders, but by the groups themselves, to kind of have more confidence that they have a role to play within suicide prevention. Because it is still a scary thing. It is still quite taboo, and people can shy away from the thought of being responsible for somebody who's in that place and in that situation.
Yeah, something that's come up over the past couple of podcasts that I've done with other people is that, and you're kind of you're pretty much saying the same thing, although you've not. I don't know if you've used the phrase yet, but like suicide prevention isn't just going to a doctor or going to A&E. It's about those things you're talking about, going to an art class, and it's almost like suicide prevention by stealth in some ways.
Definitely.
Yeah. So that's lovely. And the other thing we were talking about, so we had our Creating Hope in our community event yesterday, and something that was kind of fed back to us was like the accessibility of services. And we've all heard an anecdote, or more than one anecdote, of someone trying to get support from statutory services, and those services just not really having the capacity to deliver when needed. So there are lots of not alternatives, like you say, they're more things that run in parallel or in tandem with.
Definitely. Yeah. And I think what you were saying about that kind of signposting, if you're having these thoughts or you're having these feelings, reach out. And I think that messaging has come across the years so strongly. And I think it has become more understood, and sort of hopefully there's less fear about, reaching out. But on the flip side of that, there's so many experiences of people, making that scary step to be like, oh my gosh, I'm really struggling. I need help, reaching out for it. And then they just kind of get shut down because it's a difficulty to get an appointment. They get put on a waiting list. They're offered, medication, which can really help sort of alleviate the thoughts and feelings they're having, but it doesn't sort of tackle the root cause, and they're on a waiting list for therapy. Is it the right type of therapy they're going to be offered? There's so many things that can make sort of access to mental health support and recovery quite challenging. And like you say, peer support can be something that's a bit easier to access because it's a relationship of equals. There's not somebody there who's going to, take away what little bit of freedom you have if you kind of make reference to thoughts, because I think there can be a fear for people if they're having these really thoughts that scare themselves. And for people, I'm going to ramble on a little bit.
Please do. Please do ramble as much as you want.
Yeah, I think. Sorry, start with the question again because I've totally got.
I think I was rambling as well. We were talking about accessibility of services, and I guess I don't just mean like transport, but also cost.
Yeah.
I mean, there's a neighbourhood nearby that I guess I maybe won't name it, but residents who are listening will go. He's talking about this place. That is served by a bus that comes once every hour.
Yeah.
And it's quite a big area that has this bus, and there's for a lot of houses in that sort of area, it's quite a walk to the bus stop. So think about if you've not got a car, if walking's not that easy for you, or if you rely on the use of a wheelchair or support, then that bus isn't really an option for you, and that's been a barrier for people coming to our things. But just having those services on your doorstep sounds like it's really valuable. Yeah,
definitely. And as well as those kind of physical barriers that can prevent someone from accessing support, there's sometimes can be for different community groups or identities a fear of accessing, the sort of mainstream support services, because there's that power imbalance, and there's a fear of, parents might be afraid, will my children be taken out of my care? And sort of more recently, actually, we had an event up north, and it's something that never entered my head, coming from Edinburgh and being quite a city girl. The gun community, farmers, their livelihoods can depend on having access to firearms, and if they then are, reporting to their GP that they are feeling suicidal or struggling, that license might be taken away from them, and that's impacts on their livelihood and ability to earn. And it's just these things that you just never really considered. And then there's obviously kind of the structural barriers that kind of you just feel like you're not being understood, whether culturally or with your identity. And it's just sort of, or even bad experiences in the past when you've reached out for help. So I think the more sort of the bigger variety and the more options available to people to put the power of decision in their hands, the better.
Yeah, absolutely. A person-centred approach.
Yeah, exactly. And I think peer support is brilliant in that sense because it can take so many different forms.
Yeah, absolutely. So you mentioned a couple of examples there. Was it the Nuke in Perth?
Yeah.
Are there any other examples that you can tell us about? Because that'd be really interesting.
There's Hope Point in Dundee, and there's Mindspace, which are in Perth as well. There's other examples of peer support kind of being integrated within like A&E departments, GP services. So it is starting. And I think there's a lot of work that needs to happen because it's not just like introducing like another like nursing post or having a peer role in a service and somebody who's there using their lived experience intentionally to support somebody is a very different type of work role. And so in order for it to be a success, there needs to be understanding on both sides of what that can mean for that person in that role. So we have our peer recovery hub online, and there's resources there for people to use freely around developing peer support roles. And also please reach out to us at Scottish Recovery Network if there's things you want to discuss. And as I mentioned before, there's our Peer Connects programme. We have online events, in-person events, and we really try to make those spaces really productive for people, like a protected time and space, because we know like across the third sector and the public sector, resources and capacity are like so tight. So it's not a case of you come to our events and you kind of sit there and you listen to what's being said and shared by people. We do a little bit of that, but then we make sure there's a time to discuss, hear what other people are doing across Scotland. And, you know, hopefully people can come away from those events and have something tangible and even like the start of a work plan that they can put into action. Yeah.
Okay, that sounds really good. Let's go on to the next question that we'd kind of lined up in our script that I've not stuck to verbatim. How do you feel community-based organisations benefit from Scottish Recovery Network support?
I feel like we need to ask them. But what we have kind of heard is sort of our approach is really collaborative. We are not coming to community groups saying we're the experts at all. We come with the sort of approach of they know best what they need. They know what they're trying to achieve. And we're here to offer information, share experiences from other community groups of what's working, and, you know, provide that kind of critical friend who's there to kind of provide information, resources and space to help community groups to deliver peer support in a way that works for the people they want to support. And through the Creating Hope with Peer Support project, we've been doing that through our Creating Hope with Peer Support resource. I told you I was going to say Creating Hope with Peer Support a lot today. That's fine. Everything is named after that.
We want listeners to hear Creating Hope.
Really get that message across. You create hope with peer support, promise. But we have this resource, and it kind of tells a story a little bit of what the peer support relationship can be like and how that can support people who've been impacted by suicide. And all the kind of activities and messaging and case studies come from community peer support groups that are doing this work already. So I know you've had Donna from Neil's Hugs Foundation. She was part of that co-design work and has a case study example in the resource. There's Living Warriors, an Edinburgh group that is for people who have experienced their own attempts of suicide, and it is a place where they can talk about it quite openly in a supportive space. And loads of other groups. There's like national groups like Andy's Man Club, which is really well known. We tried to get a range as much as we could, from really small volunteer based to the national type ones. And they've created a resource that has loads of activities to kind of work through what that peer relationship is, how it can support somebody who's experiencing their own thoughts of suicide. And also there's a heavy emphasis on how to support the peer supporter. because without them, without it being sustainable, it's not going to work. We need peer supporters to be supported in their role to make sure they can continue to support as many people as possible. So it's that, I think with Scottish Recovery Network and community groups, it's always a two-way street. We're always wanting to make sure that the work that we're kind of delivering is what they need, and it comes from shared learning across Scotland and communities.
Yeah, and you know, again, you have a big focus on, I guess, not just person-centred approaches, but organisation-centred approaches, and having that real, you know, collaborative back and forth in terms of the support. So that sounds excellent. Okay, great. So what are your ambitions for creating hope with peer support, and what are you most proud of with this project?
I think starting with what I'm most proud of, like this year we've been having learning and networking events across Scotland, and we've been making sure we kind of reach kind of communities. So we've been up in Elgin, we've been in Cooper, we've been in Annan, Dundee, Perth, and although sort of they've all been so different, and like I said, sort of we had discussions with people sort of in rural areas who are part of the gun community, farmers. We've had obviously bigger city discussions and sort of the impact of poverty there. And although sort of I think having that kind of local approach has been really important, and showcasing the local community groups that have kind of come out, have been developed and evolved out of the need that's specific to those areas. But peer support is kind of a consistent message of, you know, hope and opportunity and possibility, and kind of in those learning and networking event spaces, having the public sector there. We've had nurses, GPs, prison service have been present as well. And just the feedback we get after those events of people coming and saying, like, very honestly, like, oh, I really didn't know what to expect. I was maybe even dreading coming to this event. You know, it's not a topic people are looking forward to talking about. But at the end of the event, they just feel lifted, and they realise there's so much opportunity within communities. And peer support can be something that has a much broader impact than just sort of really narrow kind of interventions that can be really quite restrictive in some cases.
Restrictive, and maybe you know, the person doesn't maybe feel like they've got a great deal of control over it. You know? Yeah. Okay, great. Well, we're coming up to the last question, really. So, how important are communities in reducing the numbers of people completing suicide, and what role do they play?
I think that role communities play is getting more and more acknowledged. And I think, like earlier, we spoke about how it feels like the message of, if you're struggling, reach out. And the kind of message has always been around sort of emergency services and your GP, and, you know, those are the kind of avenues. And I think that's is much sort of more widely understood, and as sort of people are taking those opportunities. But I think now the message of, you know, suicide prevention is everybody's business, and the Creating Hope Together strategy is really trying to look at the sort of Scotland as society as a whole, of what are the factors that are contributing to these numbers, how do we reduce those numbers. It isn't a case of looking at the individual and sort of what went wrong there. It's what is surrounding them, what is in the environment that is, you know, contributing to these numbers. And I think it's much better understood and acknowledged that community groups, services, and no matter what role you play, sort of, it doesn't matter if you're a counsellor or if you're reception at a community group, or there's always... I've lost it completely. I went on that ramble.
No. I think you because you're talking about even the, you know, the receptionist at a community group.
Yeah.
And I think about, because we're in number 18 just now, our community hub, if you like, and even the people who work on reception play a huge part in, getting to know. So, for example, there's a Ali Bali class happening in the hall downstairs. If you're listening to this in your headphones, you might have heard the screaming coming from downstairs. It is just
happy screams.
Yeah, it's happy screams. Yeah, I'm hoping I can get that with the noise reduction tools when I edit this. But people, the person that runs that, Laura, and the other people that run the other classes, and the people that work reception, or even just in the area when people are coming in, they play such a huge part in, mums coming in and just having someone to speak to, and fostering a sense of community. So everyone that's involved, even if it's someone that's not like a clinical support person.
Yeah, and obviously we are really pushing peer support in this, and people who are delivering peer support, they've not got the degrees, they've not got the clinical doctorates, but of equal value is that lived experience. And I think the fact is, so many of these community peer support groups are obviously created by people who have that lived experience, and they've been let down. They've recognised they needed a support system that wasn't there or wasn't accessible to them. So then they've went out to try and provide that for others. And I think that needs to be better resourced, better funded, better and sort of acknowledged more by sort of local authorities and the Scottish Government to provide that support and funding, because this kind of funding year by year or 3 years, it's so challenging, and these projects can have such a long-lasting impact, but they need to be supported to provide that. But yeah,
I would imagine they also need support to not just provide it, but also to provide it long term, and to be able to build those relationships over time.
Yeah, definitely.
If I could throw one wee curveball question at you. So in terms of suicide prevention as a whole in Scotland, what reasons do you think there are to be hopeful?
I think reasons to be hopeful are just the fact that it has become such a wider conversation. Obviously, there's still a level of stigma and kind of fear around bringing up the conversation around suicide, but I think that is gradually, and actually not even gradually, I think it's been challenged so much more. And I hear, like, even in the taxi here, talking to a taxi driver about it, and he was like, oh yeah, I know in my community there was a lad and all his mates, and it's so much more prevalent, and it's just that opportunity to bring it up in conversation, and people are feeling it's easier and more comfortable to do that. And I think there's such a desire, and across the sectors at the Learning Network events we're having, there's such a desire from GPs, nurses, psychologists, and the community groups to work together. We all have the same goal. There's different methods and different approaches, but we're all aiming for the same thing. We want people to feel supported, and we want people to believe mental health recovery is a possibility. So I think I'm seeing that as more and more of a possibility. And I think the Creating Hope Together strategy, having that kind of whole of society approach and not kind of just focusing on what's wrong with the individual. We're moving away from that medical model of fixing people and, actually thinking the way they're behaving and the way they're reacting and their thoughts and their mental health is actually maybe a coping and sort of understandable reaction to the environment they're in, and how do we change that environment and hopefully prevent anyone else falling into that situation as well.
Lovely. Well, that has been Catriona McDougall. Thank you so much for joining us.
Thank you so much for having me.
All right, take care.